Ever been prescribed amoxicillin and wondered, hey, can I have a beer with this? It's a super common question, and today we're going to get to the bottom of it. I'm going to break down everything you need to know about antibiotics, how they work their magic, and the real deal on mixing them with alcohol. Stick around because the answer might surprise you. First up, what exactly are antibiotics? Think of them as the superheroes of modern medicine. They're powerful drugs designed to fight bacterial infections, and honestly, they've saved countless lives. Before antibiotics, a simple cut could turn deadly. Now we can treat all sorts of nasty stuff. They either kill the bacteria outright or stop them from multiplying, giving your immune system the upper hand. So, what kind of infections are we talking about? A whole range. There are respiratory infections like pneumonia, bronchitis, and those lovely sinus infections that make your head feel like a balloon. Then you have urinary tract infections, or UTI, which can affect your bladder or kidneys. Antibiotics also tackle skin infections like cellulitis and even tummy troubles caused by bacterial gastroenteritis. They're also essential for treating some sexually transmitted infections like chlamydia and gonorrhea. Basically, if bad bacteria are causing a problem, there's likely an antibiotic that can help. Now, not all antibiotics are the same. It's like a toolbox where each tool has a specific job. Let's look at some of the most common types. First, we have the penicillins, the old school originals. Amoxicillin is a famous one in this family. They work by breaking down the bacterial cell wall, causing the bacteria to basically fall apart. Then there are cephalosporins like Cephalexin. They're similar to penicillins but often work against a wider variety of bacteria. Next are macrolides, which include drugs like azithromycin. You might know it as a Z-Pack. These guys stop bacteria from making the proteins they need to grow and multiply. Think of it as cutting off their food supply. Fluoroquinolones, like ciprofloxacin, take a different approach. They mess with the bacteria's DNA, preventing them from replicating. It's a direct hit on their ability to spread. Finally, we have sulfonamides or sulfur drugs. These block the production of folic acid, which bacteria need to survive. Humans get folic acid from our diet, but bacteria have to make it themselves, so this is a great way to target them without harming us. So how do these different methods work? It's pretty genius, actually. Antibiotics are designed to target features that are unique to bacteria. For example, our cells don't have cell walls like bacteria do. That's why penicillins and cephalosporins can destroy bacterial walls without touching our own cells. It's targeted warfare on a microscopic level. Similarly, the protein-making machinery in bacteria, called ribosomes, is slightly different from ours. Macrolides are designed to bind only to the bacterial ribosomes, shutting down their protein factory while leaving ours alone. The same principle applies to fluoroquinolones, which target enzymes specific to bacterial DNA replication, and sulfonamides, which exploit the bacteria's need to produce its own folic acid. It's all about finding that unique weakness and exploiting it. All right, let's get to the big question. Can you drink alcohol while taking antibiotics? The short answer is, it depends. But the long answer is much more important. Mixing alcohol and antibiotics is generally not a great idea, and here's why. First, alcohol can mess with how your body processes the antibiotic. It might reduce how much of the drug gets absorbed, or it could speed up how quickly your liver breaks it down. Either way, it can make the antibiotic less effective. You're taking this medicine to get better, so you don't want anything interfering with its job. Second, both alcohol and antibiotics can have side effects. Nausea, dizziness, drowsiness, and upset stomach sound familiar? When you combine them, these side effects can get much, much worse. You could end up feeling way sicker than you would from just the infection itself. And third, alcohol can weaken your immune system. Your body is already working hard to fight off an infection. Dousing it with alcohol is like telling your internal army to take a coffee break right in the middle of a battle. It can delay your recovery and make it harder for your body to heal. Now, for some antibiotics, mixing with alcohol isn't just a bad idea. It's straight up dangerous. The most famous example is Metronidazole. This drug is used for certain gut, skin, and reproductive system infections. If you drink alcohol while taking it, you can have what's called a disulfiram-like reaction. This includes severe nausea and vomiting, a flushed, red face, a racing heartbeat, and shortness of breath. Trust me, you do not want to experience this. It's incredibly unpleasant and can be quite scary. The same goes for a similar drug called metronidazole. What about other common antibiotics? Let's take Bactrim, which is a combination sulfa drug often used for UTI. While it doesn't cause that same severe reaction as metronidazole, drinking alcohol can seriously increase your chances of side effects like nausea, vomiting, and headaches. It can also, in rare cases, lead to more serious issues. How about Cephalexin, often prescribed for skin or respiratory infections? There's no direct severe interaction listed. However, since both can cause dizziness and stomach upset, combining them can make you feel pretty miserable. It's best to let your body focus on healing. And what about Macrobid, another common UTI medication? Again, no severe interaction, but it's known for causing nausea and headaches on its own. Adding alcohol into the mix is just asking for a bad time and a rougher recovery. So what's the final verdict? While a single drink with some antibiotics might not cause a major catastrophe, the safest and smartest move is to just avoid alcohol until you've finished your entire course of medication and are feeling better. Why risk feeling worse or making your medicine less effective? Here are the golden rules to live by. First and most importantly, always ask your doctor or pharmacist. They know your health history and the specific details of the medication you're taking. They will give you the most accurate advice for your situation. Don't rely on something you read online or what a friend told you. Second, read the medication label and the information leaflet that comes with your prescription. It will have specific warnings, including any about alcohol. Take those warnings seriously. They are there for a reason. And finally, listen to your body. You're sick for a reason. Your body needs rest and support to fight off the infection. Alcohol puts extra stress on your system, especially your liver, which is already working hard to process the medication. Give your body a break. Drink plenty of water, get some rest, and let the antibiotics do their job without any interference. Think of it this way. You're only on antibiotics for a short period, usually a week or two. Taking a short break from alcohol to ensure you get healthy as quickly as possible is a pretty small price to pay. Your future self will thank you for it. So, to wrap it all up, while not every antibiotic has a dangerous interaction with alcohol, it's generally a bad combo. It can make the drugs less effective, worsen side effects, and slow down your recovery. For certain antibiotics like metronidazole, it's an absolute no-go. Always check with your healthcare provider. Your health is worth more than a drink. Thanks for watching today. I hope this cleared things up for you. If you found this video helpful, please give it a thumbs up and consider subscribing for more health explainers. Stay safe, stay healthy, and I'll see you in the next video. This video is for general educational purposes only and should not be considered medical advice. It is not a substitute for professional diagnosis, treatment, or guidance from a qualified healthcare provider. Always consult your doctor, pharmacist, or other licensed medical professional regarding questions about antibiotics, alcohol consumption, or any other health-related decisions. Never disregard professional medical advice or delay seeking care because of something you have watched here.